I want to share a problem with you that causes embarrassment for a lot of women and some men too. Some decide to cover it up with thick pantyhose or vow never to wear shorts. We're talking about varicose veins. We've got Dr. Mitchell Goldman from UCSD here to tell us what issues are involved here. First of all, what causes those things?
You know, it's mostly genetic. If your parents had them, you have about a 50% risk of getting them. But the other thing, there's so many things that cause them: pregnancy, overweight, standing at a job all day. That's why it's good that we're sitting down, but the cameramen are going to be standing up getting veins. And it's almost like the straw that breaks the camel's back. The more things that cause them, the more likely you are to get them.
And is it gender specific? Do men get them as much as women?
You know, men really do, but men either have hairy legs or they cover them up, and so we don't complain as much about women. Men don't complain about the small spider veins that women care about. Men care about the veins when they're the size of your thumb.
Okay, and are they harmful? Can they cause any health problems?
You know, they really are, Lauren. A big study was done that showed that 50% of people with varicose veins are going to have either blood clots that go to their lungs, phlebitis or inflammation of the veins, or develop ulcers. And so it really is a medical problem. The worst thing is if someone's coming from far away on the plane to get here, they're going to have a problem when they arrive with blood clots. Now, these are the kind of veins that don't cause blood clots or death. These are the kinds that most women come in, they don't want to wear their shorts or their skirts because they're looking like that. And there's such a simple treatment.
Now, yeah, we showed before and after, so there must be a way to fix them, obviously.
There is, and it's a one-time treatment. There's a new FDA-approved solution called a sclera, which has been used since 1966, but just approved by the FDA for use here. It's a painless injection that we can just inject into the vein with a needle the size of a hair, so you don't even feel it. You wear a stocking on your leg for a week, and then the veins go away. Now, the reason we're talking about it now is it takes about a month or two for the veins to really go away. So if you do have veins and you want to have a treatment, you want to get in sooner than later so that your legs are going to be gorgeous for the summer.
Okay, so it's a sclera, and if they come to your office or their doctor's office, they'll know what that is.
Yes, most dermatologists, vascular surgeons can do this treatment. Takes 15, 20 minutes, usually 1 or 2 times, and they're gone.
Okay. So lasers can't do this like that?
You know, it's funny. We've tried to develop lasers over the last 25 years for leg veins. And, you know, the American public loves the word laser. They think it's high-tech and it's going to really zap them.
It's instant.
And it's instant, but it hurts like heck. Okay. So the only time I'll ever use a laser is maybe at the very end, if there's just some really fine veins that the patient comes in with a magnifying glass trying to see, then I'll go ahead and use a laser. But, you know, instead, we just do a simple injection. It's funny. People think that needles hurt when they're injected. They really don't. In the old days, we used a saltwater solution. Those days are gone. Now we use a painless solution. Doesn't hurt. Easy to get treated.
Okay. I always look forward to Tuesdays when you drop by, Dr. Goldman.